Chiropractic Health and Wellness Centre. A lot of people are surprised when we first get them on the table and we start looking at their back. Quite often we see that one leg is shorter than the other leg. Sometimes this is normal, so if it's around 0 to 5 millimeters, that's okay. When it starts to get over that 5 millimeter mark, then it can start to cause problems. Now there's a couple common reasons. The most common reason is that someone's twisting. So their pelvis is crooked, or they've hurt their low back and it's causing the muscles to be more tense on one side. Through adjustments, through muscle release, we can fix that. The next most common reason is that you've got a true short leg. Now that means you're either born with one leg that's shorter than the other, or you broke your leg, or you had a hip replacement or a knee replacement, or there's some mechanical reason that there's a difference. When that happens, what we do is actually put a lift in so we can correct that. And I've got an image here of a true short leg. So this is what we call a Ferguson view, which means that you're looking at someone's pelvis and low back. That's the left-hand side, that's the right-hand side, so you're going from back to front. The first one and then the most recent one. So what we've done is measured from one hip joint across to the other. Now see how you've got that rise just there? So for this guy, his left leg was around 10 mil shorter than his right leg. And because of that, he had this tip. That then caused a curve in the spine. Simple fix. We identified that it was a true short leg, so we couldn't adjust it out. We actually had to put a lift in. So we put a lift under his left shoe, re-x-rayed to see that there was a change, and you can see that it's brought it within about 1 millimeter of level. Now, if it's 1 millimeter, it's really not that significant. And what that does is straighten out the spine. It means he's got even weight bearing from side to side, which means he's going to have less back pain and more stability in the future. But it also means that he's got even weight going through each hip joint. That means he's less likely that one hip's going to wear out prematurely because it's doing more work than the other. Because you can think of it as if your wheels are out of the line, or your tyres are out of the line, they're going to wear unevenly, right? Same thing with your spine. So really simple fix, we put a lift in, they come in different sizes, we find the right size for you, stick it in, balance you out, make sure it's right, and that's it. If it's over 12 millimeters, so if one leg is literally 12 millimeters shorter than the other leg or more, then we actually build your shoe up, so you build the sole up, otherwise the lift will push your foot out of your shoe. That's quite rare. We see it, but it's very rare. So that's just one of the things we do, because there's a whole bunch of things we can do to stabilise someone's spine and give them a long-term correction. I thought that was worth sharing with you. I hope that was interesting. I'll catch you in the next video.